Question 1. The review process indicates that a routine cervical cytology specimen has tested positive for a high-risk HPV genotype. As a cytotechnologist, you have accurately identified this finding, and it is now time to finalize the report. You are aware that the patient's medical history does not indicate any specific symptoms, and you have no direct knowledge of their sexual history or partners. However, you understand the significant implications of high-risk HPV for cervical cancer development and potential transmission. What is the most appropriate and ethically compliant course of action regarding the reporting of this HPV finding? Option A. Report the high-risk HPV finding clearly and accurately on the cytology report, directed to the ordering physician, and await their professional judgment for patient management and counseling. Option B. Contact the patient directly to explain the implications of the HPV result and advise them to inform their sexual partner. Option C. Omit the HPV finding from the report to avoid causing unnecessary alarm to the patient and their partner. Option D. Inform the ordering physician of the HPV finding and suggest that they strongly recommend HPV vaccination for the patient's current and future partners. Correct answer is A. Report the high-risk HPV finding clearly and accurately on the cytology report, directed to the ordering physician, and await their professional judgment for patient management and counseling. Explanation. Scenario analysis. This scenario presents an ethical dilemma concerning patient confidentiality and the potential for harm to a patient and their sexual partner. When a critical finding related to HPV is identified, the cytotechnologist is faced with a situation where standard reporting protocols might not fully address the public health implications of a high-risk HPV diagnosis, particularly if the patient is unaware of the implications for their partner. The challenge lies in balancing the duty of confidentiality with the ethical imperative to prevent harm and promote public health, all within the strict confines of regulatory compliance. Correct approach analysis. The correct approach involves adhering to established laboratory protocols for reporting HPV results, which typically include clear communication of high-risk HPV findings to the ordering physician. This physician then has the responsibility to counsel the patient on the implications of the result, including potential transmission and the need for partner notification and evaluation. This aligns with regulatory frameworks that define the scope of practice for laboratory professionals and emphasize physician responsibility for patient management and counseling. It upholds patient confidentiality while ensuring that the necessary medical oversight and patient communication occur through the appropriate channels. Incorrect approach is analysis. One incorrect approach would be to directly contact the patient's sexual partner, without the explicit consent of the patient or the direction of the ordering physician. This violates patient confidentiality laws and regulations, such as HIPAA in the U.S., which strictly prohibit the unauthorized disclosure of protected health information. It also oversteps the professional boundaries of a cytotechnologist, whose role is to report findings to the clinician, not to engage in direct patient counseling or partner notification. Another incorrect approach would be to omit the HPV finding from the report altogether, or to downplay its significance. This constitutes a failure to accurately and completely report diagnostic findings, which is a direct violation of laboratory quality standards and professional ethics. It also directly undermines the diagnostic process and could lead to delayed or missed opportunities for crucial medical intervention for both the patient and potentially their partner, thereby increasing the risk of preventable disease progression. Professional reasoning. Professionals in this field must employ a decision-making process that prioritizes regulatory compliance, ethical obligations, and established professional standards. This involves 1. Understanding and strictly adhering to all applicable laws and regulations governing patient privacy and laboratory reporting. 2. Recognizing the defined roles and responsibilities within the healthcare team, particularly the distinction between laboratory reporting and physician-led patient counseling. 3. Consulting with supervisors or laboratory directors when faced with ambiguous or ethically challenging situations. 4. Prioritizing accurate and complete reporting of all diagnostic findings. 5. Upholding patient confidentiality as a paramount ethical and legal duty. Question 2. The analysis reveals a cervical cytology specimen with very scant cellularity, significant background blood obscuring the few visible cells, and no identifiable endocervical or transformation zone component. The request form indicates the sample was collected for routine cervical cancer screening. What is the most appropriate course of action for the cytotechnologist? Option A. Discard the specimen immediately as it is clearly inadequate for diagnostic purposes. Option B. Proceed with the microscopic examination and attempt to render a diagnosis based on the limited cellular material present. Option C. Process the specimen and note the limitations in the report without explicitly stating it is unsatisfactory. Option D. Report the specimen as unsatisfactory for evaluation due to inadequate cellularity and obscuring factors, and notify the submitting clinician. The correct answer is D. Report the specimen as unsatisfactory for evaluation due to inadequate cellularity and obscuring factors, and notify the submitting clinician. Explanation. This scenario presents a common challenge in cytology where the quality and type of specimen directly impact diagnostic accuracy and the ability to meet regulatory standards for patient care. The professional challenge lies in recognizing when a specimen is suboptimal and making an informed decision that prioritizes patient safety and diagnostic integrity over simply processing what is received. This requires a deep understanding of specimen acceptability criteria as defined by professional guidelines and regulatory bodies governing cytotechnology practice. The correct approach represents best professional practice because it adheres to established quality assurance protocols and regulatory mandates. By recognizing the inadequacy of the specimen and initiating the appropriate communication and documentation process, the cytotechnologist upholds the principle of providing accurate and reliable diagnostic information. This aligns with the ethical obligation to avoid rendering a diagnosis on a specimen that cannot be adequately evaluated, thereby preventing potential misdiagnosis and ensuring patient safety. Regulatory frameworks, such as those established by CLIA, Clinical Laboratory Improvement Amendments, in the U.S., mandate that laboratories have policies and procedures in place to ensure the quality of laboratory services, including specimen adequacy. Failure to address inadequate specimens can lead to regulatory noncompliance and potential sanctions. An incorrect approach of attempting to analyze an inadequate specimen fails to meet the fundamental requirements of diagnostic cytology. This is a direct violation of quality assurance principles and can lead to a false negative or false positive diagnosis, with severe consequences for patient management and outcomes. Ethically, it breaches the duty of care owed to the patient. Regulatory failures would include noncompliance with CLIA requirements for specimen acceptability and reporting, as well as potential violations of professional practice standards set by organizations like the American Society of Cytopathology, ASC. Another incorrect approach, that of discarding the specimen without proper notification or documentation, represents a significant breach of laboratory protocol and regulatory requirements. This prevents proper investigation into the cause of the inadequate specimen and deprives the clinician of the opportunity to obtain a new sample. It also hinders quality improvement efforts within the laboratory. Such an action would likely violate laboratory policies regarding specimen handling and documentation, as well as CLIA regulations concerning record-keeping and specimen tracking. A professional decision-making process for similar situations should involve a systematic evaluation of the specimen against established adequacy criteria. This includes assessing cellularity, preservation, presence of obscuring material, and the ability to identify diagnostic cells. If the specimen is deemed inadequate, the next step should involve immediate communication with the submitting clinician, clear documentation of the inadequacy, and adherence to laboratory protocols for specimen rejection or request for recollection. This process ensures transparency, accountability, and ultimately, the delivery of high-quality patient care. Question 3. Governance review demonstrates a need to enhance the diagnostic accuracy of cytotechnologists in differentiating common cancers, considering the cytomorphology of lung, breast, cervical, and thyroid cancers, which approach best ensures accurate and reliable diagnoses while adhering to professional standards. Option A. Prioritizing the identification of a single, most striking cytomorphological abnormality to expedite the diagnostic process. Option B. A comparative analysis of key cytomorphological features across these cancer types, considering nuclear and cytoplasmic characteristics, cellular arrangement, and background elements, in conjunction with established diagnostic criteria. Option C. Relying on pattern recognition of a few characteristic features without a systematic evaluation of all cellular components. Option D. Making a definitive diagnosis based on the presence of any atypical cells, regardless of the quantity or quality of cellular material. The correct answer is B. A comparative analysis of key cytomorphological features across these cancer types, considering nuclear and cytoplasmic characteristics, cellular arrangement, and background elements, in conjunction with established diagnostic criteria. Explanation: scenario analysis. This scenario presents a professional challenge in accurately differentiating cytomorphological features of common cancers, specifically lung, breast, cervical, and thyroid. The difficulty lies in the potential for overlapping features, the need for meticulous observation, and the critical impact of accurate diagnosis on patient management and treatment. Cytotechnologists must possess a deep understanding of the subtle nuances that distinguish benign from malignant cells and differentiate between various cancer types, all while adhering to strict diagnostic criteria and quality assurance standards. Correct approach analysis. The correct approach involves a systematic, comparative analysis of cytomorphological features across the specified cancer types. This method leverages established diagnostic criteria and pattern recognition, allowing for a comprehensive evaluation of nuclear and cytoplasmic characteristics, cellular arrangement, and background elements. This aligns with best professional practice by ensuring a thorough and evidence-based diagnostic process. Adherence to established guidelines, such as those from the College of American Pathologists, CAP, or relevant professional cytotechnology organizations within the specified jurisdiction, is paramount for consistent and reliable diagnoses, directly impacting patient care and regulatory compliance. Incorrect approaches analysis. One incorrect approach would be to rely solely on a single prominent feature without considering the totality of cytomorphological findings. This can lead to misdiagnosis due to the variability of cellular presentation and the presence of mimickers. Ethically, this represents a failure to exercise due diligence and professional judgment, potentially resulting in inappropriate patient management. From a regulatory standpoint, it deviates from the expected standard of care and quality assurance protocols designed to ensure diagnostic accuracy. Another incorrect approach would be to prioritize speed over accuracy, making rapid assessments without sufficient microscopic examination. This is professionally unacceptable as it compromises the integrity of the diagnostic process. Regulatory frameworks for cytotechnology certification emphasize accuracy and thoroughness. Failing to dedicate adequate time to microscopic evaluation constitutes a breach of professional responsibility and can lead to significant patient harm, violating ethical obligations, and potentially leading to disciplinary action under certification guidelines. A third incorrect approach would be to make a diagnosis based on limited or insufficient cellular material. While some diagnoses can be made with sparse material, a definitive diagnosis of malignancy, especially when differentiating between specific cancer types, often requires adequate cellular representation. Relying on insufficient material can lead to false negatives or misclassifications, which are serious diagnostic errors. This approach fails to meet the quality standards expected in cytopathology and can have severe consequences for patient care, violating ethical principles of beneficence and non-maleficence. Professional reasoning. Professionals should approach cytomorphological analysis with a systematic methodology. This involves first assessing the adequacy of the specimen. Then, a comprehensive evaluation of cellular morphology should be conducted, paying close attention to nuclear features, size, shape, chromatin pattern, nuclear membrane irregularities, cytoplasmic characteristics, amount, color, vacuolization, presence of inclusion, and the overall architecture and arrangement of cells. A comparative analysis considering the differential diagnoses for the specific tissue source is crucial. This systematic process, guided by established diagnostic criteria and quality assurance protocols, ensures accuracy and adherence to regulatory and ethical standards. Question 4. System analysis indicates a cytotechnologist has been approached by a colleague in another department who is requesting direct access to review a specific patient's cytology slides from a past case. The colleague states they are curious about the case and want to learn from it for their own professional development, but they have not obtained formal authorization from the patient's treating physician or the pathology department to access these slides. The cytotechnologist is aware of the strict protocols for accessing patient specimens and records. Which of the following actions best upholds the cytotechnologist's professional and ethical obligations? Option A. Ignore the colleague's request, assuming they will eventually obtain the proper authorization if it is truly necessary. Option B. Grant the colleague access to the slides, as professional curiosity and learning are generally encouraged in healthcare settings. Option C. Politely decline to provide direct access to the slides, explaining that formal authorization from the treating physician or pathology department is required before any patient material can be reviewed, and suggest the colleague follow the established protocol for requesting such access. Option D. Provide the colleague with direct access to the slides, but verbally remind them of the importance of patient confidentiality. The correct answer is C. Politely decline to provide direct access to the slides, explaining that formal authorization from the treating physician or pathology department is required before any patient material can be reviewed, and suggest the colleague follow the established protocol for requesting such access. Explanation. This scenario presents an ethical dilemma for a cytotechnologist regarding patient confidentiality and the appropriate handling of diagnostic information when a colleague requests access to patient slides for personal, non-diagnostic purposes. The core challenge lies in balancing professional collegiality with the stringent ethical and regulatory obligations to protect patient privacy. The correct approach prioritizes patient confidentiality and adherence to establish protocols for accessing patient records and specimens. This aligns with the fundamental ethical principles of medical practice and the regulatory framework governing cytotechnology, which mandates strict control over patient information. By refusing to provide direct access to slides without proper authorization, and instead directing the colleague to the appropriate channels, the cytotechnologist upholds their professional responsibility. This action ensures that any review of patient material is conducted within a legitimate, documented, and authorized context, thereby safeguarding patient rights and maintaining the integrity of the laboratory's operations. This approach is best professional practice because it adheres to the principle of do no harm by preventing potential breaches of confidentiality and misuse of patient data. An incorrect approach would involve providing direct access to the patient slides without verifying the colleague's authorization or the purpose of the review. This action directly violates patient confidentiality, a cornerstone of medical ethics and regulatory compliance. Such a breach could lead to disciplinary action, including sanctions from certification bodies and potential legal repercussions. It undermines the trust placed in healthcare professionals by patients and the public. Another incorrect approach would be to ignore the request entirely, failing to respond or acknowledge the colleague's inquiry. While this might seem like a passive way to avoid direct involvement in a potential breach, it is professionally irresponsible. It fails to address the colleague's request appropriately and could be interpreted as an unwillingness to engage in professional discourse or to uphold established protocols. Furthermore, it misses an opportunity to educate the colleague on proper procedures, potentially perpetuating a misunderstanding of ethical and regulatory requirements. A third incorrect approach would be to provide the slides, but with a verbal warning about confidentiality. While this shows some awareness of the issue, it is still insufficient. Verbal warnings lack the formal documentation and authorization required for accessing patient materials. The responsibility for ensuring proper authorization and adherence to protocols rests with the cytotechnologist, not solely on a verbal assurance from a colleague. This approach still exposes the patient to a risk of confidentiality breach and does not fully comply with the stringent requirements for specimen access. The professional decision-making process in such situations should involve a clear understanding of the ethical principles of patient confidentiality, autonomy, and beneficence, as well as the specific regulatory requirements of the cytotechnology certification framework. When faced with a request that seems to deviate from standard practice, the professional should 1. Pause and assess the request against established protocols and ethical guidelines. 2. Seek clarification on the purpose and authorization for the request. 3. If authorization is unclear or absent, politely but firmly decline direct access and guide the requester to the appropriate channels, e.g., supervisor, medical director, pathology department. 4. Document the interaction and the decision made. This systematic approach ensures that patient rights are protected, regulatory compliance is maintained, and professional integrity is upheld. Question 5. During the evaluation of a Papanicoleu pap smear, a cytotechnologist observes a significant increase in the number of squamous cells in a particular area, with some cells appearing larger than typical. The cells maintain their normal nuclear-cytoplasmic ratio and have finely granular chromatin. The patient's clinical history indicates chronic inflammation. Considering the principles of cellular adaptation, which of the following interpretations best reflects the most appropriate initial assessment by the cytotechnologist? Option A. The observed cellular changes are definitively indicative of squamous intraepithelial lesion CIL due to the increased cell number and size. Option B. The observed increase in cell number and size, in the context of chronic inflammation and normal nuclear features, is most consistent with hyperplasia and potentially hypertrophy, representing a reactive cellular adaptation. Option C. The presence of larger cells necessitates a diagnosis of dysplasia, regardless of other cellular characteristics or clinical history. Option D. The increased cell size alone is sufficient evidence to diagnose a neoplastic process, requiring immediate referral for biopsy. The correct answer is B. The observed increase in cell number and size, in the context of chronic inflammation and normal nuclear features, is most consistent with hyperplasia and potentially hypertrophy, representing a reactive cellular adaptation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of cellular changes and the ethical obligation to provide accurate and timely diagnosis. A cytotechnologist must balance the recognition of normal adaptive changes with the identification of potentially pathological processes, all while adhering to strict diagnostic criteria and reporting standards. The pressure to provide a definitive diagnosis, coupled with the inherent variability in cellular morphology, necessitates a rigorous and systematic approach. Correct approach analysis. The correct approach involves meticulously documenting all observed cellular changes, correlating them with clinical information, and consulting with a pathologist when necessary. This aligns with the fundamental principles of diagnostic accuracy and patient care, which are paramount in cytopathology. Regulatory frameworks for cytotechnology certification emphasize the importance of accurate specimen evaluation, proper documentation, and adherence to established diagnostic guidelines. Professional ethics dictate that a cytotechnologist must act in the best interest of the patient by ensuring the highest quality of diagnostic services. This approach upholds the integrity of the diagnostic process and minimizes the risk of misdiagnosis. Incorrect approaches analysis. One incorrect approach involves immediately classifying all observed cellular changes as indicative of disease without considering the possibility of benign adaptations. This fails to meet the regulatory requirement for thorough and nuanced evaluation, potentially leading to unnecessary patient anxiety and further invasive procedures. Ethically, it breaches the duty of care by not considering all plausible interpretations. Another incorrect approach is to dismiss significant cellular alterations as insignificant without proper investigation or consultation. This disregards the potential for subtle but important pathological changes and violates the professional standard of care. Regulatory guidelines mandate that all findings be assessed and reported appropriately, and failing to do so can have serious consequences for patient management. A third incorrect approach is to rely solely on pattern recognition, without a deep understanding of the underlying cellular mechanisms of adaptation. While pattern recognition is a crucial skill, it must be grounded in a solid theoretical understanding of hypertrophy, hyperplasia, atrophy, and metaplasia to differentiate benign adaptive changes from early neoplastic processes. This approach risks misinterpreting adaptive changes as pathological, leading to incorrect diagnoses and potentially harmful interventions. It also fails to meet the educational and competency requirement expected of certified cytotechnologists. Professional reasoning. Professionals in this field must employ a systematic decision-making process that begins with a thorough review of the specimen and clinical history. This is followed by a detailed microscopic examination, applying knowledge of normal cellular morphology and recognizing deviations. When faced with ambiguous findings or changes suggestive of adaptation, the professional must consider the differential diagnosis, including benign adaptive processes and early pathological changes. Consultation with a pathologist is a critical step when uncertainty exists, ensuring that the final diagnosis is accurate and clinically relevant. Adherence to established protocols, continuous professional development, and a commitment to ethical practice are essential for navigating complex diagnostic challenges. Question 6. The evaluation methodology shows a cytotechnologist examining a pap smear. Which of the following actions best demonstrates adherence to best practices in cytopathology screening under U.S. regulatory frameworks? Option A. Performing a rapid scan of the slide to identify obvious abnormalities, then focusing on areas of concern. Option B. Interpreting the slide without considering the presence of significant inflammation that obscures cellular detail. Option C. Relying primarily on automated screening software to flag potential abnormalities with minimal manual review. Option D. Systematically evaluating cellular morphology, assessing specimen adequacy, and documenting all findings according to established guidelines. The correct answer is D. Systematically evaluating cellular morphology, assessing specimen adequacy, and documenting all findings according to established guidelines. Explanation. The evaluation methodology shows a cytotechnologist reviewing a Papanicolau (PAP) smear for cervical cancer screening. The challenge lies in accurately identifying subtle cellular abnormalities that could indicate precancerous or cancerous changes, while also ensuring the sample is technically adequate for interpretation. This requires a deep understanding of cellular morphology, artifact recognition, and adherence to established diagnostic criteria. The professional responsibility extends to ensuring patient safety through accurate and timely reporting, which is governed by specific regulatory frameworks for cytopathology practice. The correct approach involves meticulous microscopic examination, systematic evaluation of cellular components, and comparison with established diagnostic criteria as outlined by regulatory bodies governing cytotechnology practice in the United States, such as CLIA Clinical Laboratory Improvement Amendments and CAP College of American Pathologists guidelines. This ensures that the interpretation is objective, reproducible, and meets the highest standards of quality assurance. Adherence to these guidelines is paramount for patient care and legal compliance. An incorrect approach would be to rush the examination, relying on superficial pattern recognition without detailed scrutiny of individual cells and their nuclear and cytoplasmic features. This could lead to misdiagnoses or false positives, both of which have significant patient implications and violate regulatory requirements for proficiency and accuracy. Another incorrect approach would be to disregard the presence of obscuring factors like inflammation or blood, as these can compromise the adequacy of the sample and necessitate a repeat collection, a procedural step mandated by quality control standards. Failing to document all findings, including technical adequacy and any limitations, is also a regulatory failure, as comprehensive record-keeping is a cornerstone of laboratory practice. Professional decision-making in such scenarios requires a systematic, evidence-based approach. This involves understanding the clinical context, critically evaluating the specimen's technical quality, applying established diagnostic criteria consistently, and documenting all observations thoroughly. When in doubt, consulting with a pathologist or a more experienced colleague is a critical step in ensuring diagnostic accuracy and upholding professional standards. Question 7. Benchmark analysis indicates that a cytotechnologist has identified a critical finding in a patient's cervical cytology specimen that requires immediate clinical attention. The ordering physician's direct contact information is readily available. Which of the following represents the most appropriate and compliant course of action for the cytotechnologist? Option A. Send the critical finding to the patient via personal email, advising them to contact their physician. Option B. Discuss the critical finding with a fellow cytotechnologist in the hospital cafeteria while waiting for lunch. Option C. Hold the critical finding report until the next scheduled departmental review meeting to discuss it with colleagues. Option D. Immediately contact the ordering physician directly via secure phone call to report the critical finding and document the communication. Correct answer is D. Immediately contact the ordering physician directly via secure phone call to report the critical finding and document the communication. Explanation. Scenario analysis. This scenario presents a professional challenge where a cytotechnologist must navigate the ethical and regulatory landscape surrounding patient confidentiality and the appropriate dissemination of diagnostic information. The core difficulty lies in balancing the need for timely communication of critical findings with the strict requirements of patient privacy and the established protocols for reporting. Missteps can lead to breaches of confidentiality, regulatory violations, and erosion of patient trust. Correct approach analysis. The correct approach involves adhering strictly to established laboratory and healthcare facility policies for reporting critical findings. This typically includes direct communication with the ordering physician or designated healthcare provider, documenting the communication, and ensuring the information is conveyed through secure, authorized channels. This practice aligns with regulatory frameworks such as HIPAA in the U.S., which mandates the protection of protected health information. 5. It upholds ethical principles of patient autonomy and confidentiality by ensuring that sensitive diagnostic information is shared only with authorized individuals who can act upon it appropriately within the patient's care plan. This method also ensures accountability and provides a clear audit trail. Incorrect approaches analysis. One incorrect approach involves sharing critical findings directly with the patient via unsecured personal communication methods, e.g., personal email, text message. This violates patient privacy regulations, like HIPAA, by disclosing PHI without proper authorization or secure transmission. It bypasses the physician's role in interpreting results and counseling the patient, potentially leading to patient anxiety or misunderstanding. Another incorrect approach is to delay reporting critical findings until the next scheduled interdepartmental meeting or until a formal report is generated and mailed. This failure to communicate promptly can have severe clinical consequences for the patient, potentially violating the ethical duty to act in the patient's best interest and leading to adverse patient outcomes. It also fails to meet regulatory expectations for timely reporting of critical results, which are designed to facilitate immediate patient management. A third incorrect approach is to discuss the critical findings with a colleague in a non-secure, public area of the laboratory or hospital. This constitutes a breach of confidentiality, as it exposes PHI to unauthorized individuals and violates privacy regulations. It demonstrates a lack of professional discretion and disregard for the sensitive nature of patient health information. Professional reasoning. Professionals should employ a decision-making process that prioritizes patient safety, regulatory compliance, and ethical conduct. This involves understanding and consistently applying laboratory and institutional policies for critical value reporting. When faced with a critical finding, the immediate step should be to identify the appropriate reporting pathway as defined by policy, ensure secure and direct communication with the authorized healthcare provider, and meticulously document all actions taken. If unsure about a policy or procedure, seeking clarification from a supervisor or designated compliance officer is paramount. This systematic approach ensures that patient care is not compromised and that all legal and ethical obligations are met. Question 8. Regulatory review indicates that the development of cytopathology as a distinct diagnostic discipline is a critical component of foundational knowledge for certified cytotechnologists. Considering the historical trajectory of this field, which of the following most accurately reflects the primary individual credited with establishing the scientific basis for diagnostic exfoliative cytology? Option A, Camillo Golgi. Option B, Rudolf Virchow. Option C, George Papanicolaou. Option D, Walther Fleming. Correct answer is C, George Papanicolaou. Explanation. Scenario analysis. This scenario presents a challenge for a cytotechnologist involved in the historical documentation of their field. The difficulty lies in accurately attributing the foundational contributions to cytopathology without oversimplifying complex scientific evolution or misrepresenting the roles of key figures. Professionals must navigate the nuances of scientific discovery, recognizing that progress is often iterative and collaborative, rather than solely the product of a single individual. This requires a deep understanding of the historical context and the specific contributions that shape the discipline. Correct approach analysis. The correct approach accurately identifies George Papanicolaou as the pivotal figure whose work laid the groundwork for modern cytopathology, particularly through his development of the Pap smear. This is best professional practice because it aligns with the widely accepted historical narrative and the significant impact of his research on diagnostic cytology. Regulatory frameworks for cytotechnology certifications. while not always explicitly detailing historical figures, implicitly endorse the foundational knowledge that underpins the profession. Recognizing Papanicolaou's contribution is essential for understanding the evolution of screening methods and the scientific basis of cytological examination, which is a core competency for certified cytotechnologists. Incorrect approaches analysis. One incorrect approach might focus solely on early microscopic observations without acknowledging the development of specific diagnostic techniques. This fails to recognize that cytopathology as a distinct field emerged from the application of microscopy to cellular analysis for diagnostic purposes, a leap made by Papanicolaou. Another incorrect approach might attribute the development of cytopathology to a later figure who refined existing techniques but did not establish the fundamental principles. This would be a failure to acknowledge the origin of the discipline and the initial breakthroughs that enabled its existence. Attributing the development to a collective of unnamed researchers without identifying the primary innovator would also be an incomplete and potentially misleading representation of scientific history, failing to provide the specific, verifiable knowledge expected in a certification context. Professional reasoning. Professionals should approach historical questions by seeking consensus from authoritative sources within the field of pathology and cytology. This involves consulting peer-reviewed historical articles, established textbooks on cytopathology, and professional society publications. When evaluating contributions, it is crucial to distinguish between foundational discoveries and subsequent refinements or applications. The decision-making process should prioritize accuracy, verifiable evidence, and the recognition of individuals whose work demonstrably shifted the paradigm of the discipline. This ensures that the knowledge base is robust and reflects the accepted understanding of the field's development. Question 9. The monitoring system demonstrates a discrepancy between the FISH assay results for a specific gene rearrangement and the cytomorphological findings in a Papanicolaou smear. The FISH assay indicates a positive result for the rearrangement, while the cytological assessment shows no definitive evidence of malignancy suggestive of this rearrangement. What is the most appropriate next step for the cytotechnologist to ensure accurate and reliable diagnostic reporting? Option A. Immediately report the FISH assay result as positive, assuming the molecular test is definitive and overrides the cytological interpretation. Option B. Proceed with reporting the cytological findings as negative for malignancy, without further investigation into the discordant FISH result. Option C. Review the FISH assay's quality control data. Re-examine the cytological slides with a focus on subtle morphological features that might correlate with the FISH finding, and consult with a pathologist regarding the discordant results. Option D. Disregard the FISH assay result, concluding that the cytological findings are more reliable and the molecular test may have produced a false positive. The correct answer is C. Review the FISH assay's quality control data. Re-examine the cytological slides with a focus on subtle morphological features that might correlate with the FISH finding, and consult with a pathologist regarding the discordant results. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical need for accurate and timely molecular diagnostic results in cytopathology, directly impacting patient diagnosis and treatment. The cytotechnologist must navigate the complexities of molecular techniques, ensuring adherence to established protocols and regulatory standards for quality assurance and patient safety. The integration of these advanced techniques requires a thorough understanding of their principles, limitations, and appropriate application within the cytopathology workflow. Correct approach analysis. The correct approach involves a systematic review of the molecular assay's performance characteristics, including sensitivity, specificity, and established quality control parameters, in conjunction with the cytological findings. This aligns with the regulatory framework for cytotechnology certifications, which emphasizes proficiency in interpreting diagnostic tests and ensuring their reliability. By correlating molecular results with cytological morphology and considering potential sources of error, the cytotechnologist upholds best professional practice, ensuring that diagnostic conclusions are robust and evidence-based. This approach is ethically mandated to provide accurate patient care and is supported by guidelines promoting the integration of molecular data into diagnostic reporting. Incorrect approaches analysis. One incorrect approach would be to solely rely on the molecular assay's raw output without critical evaluation of its concordance with cytological findings or consideration of potential technical artifacts. This fails to meet the professional responsibility of a cytotechnologist to provide a comprehensive diagnostic interpretation. Ethically, it risks misdiagnosis and inappropriate patient management. Regulatory failure lies in not adhering to quality assurance protocols that mandate correlation and critical review of all diagnostic data. Another incorrect approach would be to dismiss discordant results without further investigation or consultation. This bypasses essential troubleshooting steps and the collaborative nature of diagnostic pathology. It represents a failure to exercise due diligence and can lead to misdiagnoses or false positives, violating professional standards and potentially patient trust. Regulatory noncompliance stems from neglecting established procedures for resolving analytical discrepancies. A third incorrect approach would be to report findings based on preliminary or unvalidated molecular data. This directly contravenes regulatory requirements for the use of validated diagnostic assays and established reporting standards. It poses a significant ethical risk by providing premature or unreliable information to clinicians, compromising patient care, and undermining the integrity of the diagnostic process. Professional reasoning. Professionals should approach such situations by first understanding the specific molecular technique employed and its expected performance. They must then critically evaluate the molecular data in the context of the cytological findings, looking for concordance or discordance. When discrepancies arise, a systematic troubleshooting process should be initiated, which may involve retesting, reviewing sample quality, or consulting with colleagues or supervisors. Adherence to laboratory standard operating procedures, SOP, and regulatory guidelines for quality control and reporting is paramount. Ethical considerations demand a commitment to accuracy, patient safety, and transparent communication of findings. Question 10. The control framework reveals a need to optimize the process for identifying and reporting abnormal cellular findings in cytopathology specimens. Which of the following strategies best supports this objective while upholding diagnostic accuracy and regulatory compliance? Option A. Implementing a tiered review system where all cases are initially screened by a senior cytotechnologist, with a subset requiring secondary review by a pathologist, and utilizing standardized digital imaging for difficult cases to facilitate consultation. Option B. Encouraging cytotechnologists to rely on automated cell counting software for preliminary abnormality detection, bypassing manual microscopic screening for routine cases. Option C. Introducing a new, unvalidated rapid staining technique to decrease slide preparation time, without concurrent validation studies or pathologist approval. Option D. Reducing the minimum number of slides examined per specimen to expedite processing, relying solely on the cytotechnologist's initial assessment for reporting. The correct answer is A. Implementing a tiered review system where all cases are initially screened by a senior cytotechnologist, with a subset requiring secondary review by a pathologist, and utilizing standardized digital imaging for difficult cases to facilitate consultation. Explanation. The control framework reveals a need to optimize the process for identifying and reporting abnormal cellular findings in cytopathology specimens. This scenario is professionally challenging because it requires balancing the need for efficiency with the absolute imperative of diagnostic accuracy and patient safety. Cytotechnologists must ensure that no critical findings are missed while also streamlining workflows to manage workload effectively. Careful judgment is required to implement changes that improve turnaround time without compromising the quality of the diagnostic interpretation. The correct approach represents best professional practice because it involves a systematic, evidence-based review of existing protocols and the implementation of validated techniques. This aligns with the fundamental principles of quality assurance and continuous improvement mandated by regulatory bodies governing cytotechnology practice. By focusing on standardized staining procedures, optimized microscopy techniques, and clear communication channels, the laboratory ensures consistent and reliable diagnostic results, directly impacting patient care and adhering to established professional standards. An incorrect approach that prioritizes speed over thoroughness would represent a significant regulatory and ethical failure. This could lead to misdiagnoses, delayed treatment, and potential harm to patients, violating the core ethical obligation to provide competent and diligent care. Another incorrect approach that involves bypassing established quality control measures or failing to document changes adequately would contraindicate regulatory compliance. Such actions undermine the integrity of the diagnostic process and expose the laboratory and its personnel to legal and professional repercussions. Failing to seek peer review or expert consultation when encountering complex or equivocal cases is also a failure, as it deviates from the collaborative and consultative nature of medical diagnostics, potentially leading to misinterpretation and suboptimal patient management. The professional decision-making process for similar situations should involve a comprehensive assessment of the current workflow, identification of specific bottlenecks or areas for improvement, and the exploration of evidence-based solutions. This should include consulting relevant professional guidelines, engaging in interdisciplinary discussions with pathologists and other laboratory staff, and implementing changes in a phased, controlled manner with robust quality monitoring. Documentation of all changes, training, and outcomes is crucial for regulatory compliance and continuous quality improvement. Question 11. Implementation of a new cytological staining technique designed to enhance the visualization of cellular senescence markers in routine Papanicolau smears. What is the most appropriate process optimization strategy to ensure diagnostic accuracy and regulatory compliance? Option A. Adopt the new staining technique based on a single published study demonstrating its potential, without performing internal validation or comparative analysis. Option B. Immediately integrate the new staining technique into the daily workflow, relying on the lead technologist's initial positive impressions and anecdotal observations to gauge its effectiveness. Option C. Implement the new staining technique only for retrospective case reviews where cost is a primary concern, without formal validation for prospective diagnostic use. Option D. Conduct a comprehensive validation study comparing the new staining technique against established methods for senescence marker detection, establishing performance metrics, and documenting all findings before routine implementation. The correct answer is D. Conduct a comprehensive validation study comparing the new staining technique against established methods for senescence marker detection, establishing performance metrics, and documenting all findings before routine implementation. Explanation. The scenario presents a common challenge in cytopathology, optimizing laboratory processes to improve diagnostic accuracy and efficiency while adhering to stringent regulatory standards. In the context of cellular aging and senescence, understanding and accurately identifying these cellular changes is crucial for diagnosing various conditions, including cancer and age-related diseases. The challenge lies in developing and implementing protocols that reliably detect and quantify senescent markers without introducing artifacts or compromising the integrity of the cellular sample. This requires a deep understanding of both the biological markers of senescence and the technical aspects of cytological preparation and analysis. Careful judgment is needed to balance the need for comprehensive analysis with the practical constraints of a clinical laboratory. The correct approach represents best professional practice because it prioritizes validation and standardization of new methodologies. Implementing a new technique for assessing cellular aging and senescence requires rigorous testing to ensure its accuracy, reproducibility, and reliability. This aligns with regulatory requirements for laboratory quality assurance, which mandate that all diagnostic tests and procedures be validated before routine use. By establishing clear performance metrics and conducting comparative studies against established methods, the laboratory demonstrates a commitment to providing accurate and dependable results. This systematic approach minimizes the risk of misdiagnosis and ensures that patient care is based on sound scientific evidence, fulfilling ethical obligations to patients and adhering to the principles of good laboratory practice as outlined by relevant professional bodies and regulatory agencies. An incorrect approach that involves immediate adoption of a novel, unvalidated technique without proper assessment poses significant regulatory and ethical risks. Such an approach fails to meet the fundamental requirement for analytical and clinical validation of diagnostic tests. This could lead to the generation of inaccurate or misleading results, potentially causing patient harm through misdiagnosis or delayed treatment. Ethically, it breaches the duty of care owed to patients. From a regulatory standpoint, it violates quality assurance mandates that require laboratories to operate under approved and validated protocols. Another incorrect approach focusing solely on cost reduction without considering the impact on diagnostic accuracy, is also professionally unacceptable. While efficiency is important, it must not come at the expense of diagnostic integrity. Regulatory frameworks emphasize that cost-saving measures should not compromise the quality or validity of patient testing. This approach could lead to the adoption of less sensitive or specific methods, increasing the risk of false negatives or positives, which has direct implications for patient outcomes and can result in regulatory noncompliance. A third incorrect approach, relying solely on anecdotal evidence or the experience of a single technologist without formal validation, is similarly flawed. While individual expertise is valuable, it cannot substitute for objective, data-driven validation. Regulatory bodies require documented evidence of a method's performance characteristics. Relying on subjective assessments without empirical data undermines the scientific basis of laboratory diagnostics and exposes the laboratory to regulatory scrutiny and potential sanctions. The professional decision-making process for similar situations should involve a systematic evaluation of any proposed new methodology. This includes a thorough literature review, assessment of the scientific basis of the technique, and a clear understanding of its potential impact on patient care. A critical step is the development of a validation plan that outlines the specific performance metrics to be evaluated, e.g., sensitivity, specificity, accuracy, precision, linearity. This plan should be executed rigorously, with results documented and reviewed by qualified personnel. Any implementation should be phased, with ongoing quality control and proficiency testing to ensure continued performance. Adherence to established quality management systems and regulatory guidelines is paramount throughout this process. Question 12. The assessment process reveals a cytotechnologist preparing a conventional pap smear from a cervical sample. The specimen appears to have been collected with a moderate amount of cellular material, but there is a slight delay between collection and fixation. The technologist is considering the most appropriate immediate action to ensure optimal cellular preservation for subsequent staining and microscopic examination. Option A. Gently rinse the slide in a fixative solution for a specified duration, then blot excess fluid and submit it directly for staining without any air drying period. Option B. Immediately apply a fixative spray to the entire slide, ensuring even coverage, and then submit it directly for staining without any air drying period. Option C. Immediately apply a fixative spray to the entire slide, ensuring even coverage, and then allow it to air dry for a brief period before further processing. Option D. Gently rinse the slide in a fixative solution for a specified duration, then blot excess fluid and allow it to air dry completely before submitting it for staining. The correct answer is C. Immediately apply a fixative spray to the entire slide, ensuring even coverage, and then allow it to air dry for a brief period before further processing. Explanation. The assessment process reveals a common challenge in cytopathology, ensuring optimal specimen preparation for accurate diagnostic interpretation, especially when faced with limited sample volume or suboptimal collection techniques. This scenario demands a deep understanding of the principles of specimen fixation, preservation, and processing to maximize the diagnostic yield while adhering to established laboratory protocols and regulatory guidelines. The professional challenge lies in balancing the need for a diagnostically adequate sample with the constraints of the material provided, requiring critical judgment and technical proficiency. The correct approach represents best professional practice because it prioritizes the integrity of the cellular material for accurate cytological evaluation. This involves selecting the most appropriate fixation method based on the specimen type and anticipated diagnostic tests, ensuring proper staining characteristics, and minimizing artifact formation. Adherence to established laboratory standard operating procedures, SOP, and the guidelines set forth by relevant professional organizations, e.g., Papanicolaou Society of Cytopathology, College of American Pathologists, is paramount. These guidelines often dictate specific fixation times, reagent concentrations, and processing techniques to ensure cellular morphology is preserved, and diagnostic markers can be reliably detected. For instance, using an appropriate fixative like 95% ethanol for liquid-based cytology or a spray fixative for conventional smears preserves cellular detail and prevents drying artifact, which is crucial for accurate interpretation. An incorrect approach that involves inadequate fixation, such as allowing a conventional smear to air dry completely before fixation, leads to significant cellular distortion and artifact, rendering the specimen difficult or impossible to interpret accurately. This directly violates the principle of providing a diagnostically adequate specimen and can result in false negative or false positive diagnoses, impacting patient care. Another incorrect approach, such as overfixation in certain fixatives, can lead to nuclear pycnosis and cytoplasmic hardening, obscuring fine cytological details essential for identifying subtle cellular abnormalities. This also compromises diagnostic accuracy and fails to meet the standards of care. Furthermore, failing to follow specific protocols for different specimen types, e.g., using a fixative unsuitable for immunocytochemistry on a sample intended for such analysis, represents a failure to adhere to best practices and can lead to the loss of valuable diagnostic information. The professional reasoning process for such situations involves a systematic evaluation of the specimen's condition upon receipt. This includes assessing the collection method, the volume and type of material, and any visible signs of degradation or artifact. Based on this assessment, the technologist must apply their knowledge of fixation principles and laboratory SOPs to select the most appropriate preparation method. If the specimen is suboptimal, the technologist should document the limitations and, if possible, consult with a supervisor or pathologist to determine the best course of action to maximize diagnostic potential or to communicate the limitations to the requesting clinician. This decision-making process emphasizes quality control, adherence to established protocols, and clear communication to ensure patient safety and diagnostic integrity. Question 13. The audit findings indicate a need to refine the laboratory's approach to differentiating apoptotic from necrotic cells in cytological specimens. Which of the following represents the most appropriate risk mitigation strategy for ensuring accurate classification? Option A. Focusing primarily on the presence of nuclear pycnosis as the defining characteristic for apoptotic cells, as this is often the most readily apparent change. Option B. Assuming all cellular debris and inflammatory infiltrates are indicative of necrosis, simplifying the diagnostic process. Option C. Relying on automated image analysis software to flag potential apoptotic or necrotic cells, reducing the need for manual microscopic review. Option D. Implementing a standardized checklist of key morphological features for apoptosis and necrosis, requiring review by a second qualified cytotechnologist for any equivocal cases. The correct answer is D. Implementing a standardized checklist of key morphological features for apoptosis and necrosis, requiring review by a second qualified cytotechnologist for any equivocal cases. Explanation: scenario analysis. This scenario is professionally challenging because it requires a cytotechnologist to interpret subtle morphological differences between two distinct cellular processes, apoptosis and necrosis, within the context of potential diagnostic implications. Misinterpretation can lead to incorrect diagnoses, affecting patient management and treatment. The audit findings highlight a need for rigorous quality control and adherence to established diagnostic criteria, emphasizing the importance of accurate morphological assessment. Correct approach analysis. The correct approach involves a systematic evaluation of key morphological features that differentiate apoptosis from necrosis. This includes assessing nuclear changes, condensation, fragmentation, cytoplasmic alterations, shrinkage, blebbing, and the overall integrity of the cell and surrounding tissue. Adherence to established cytological criteria, as outlined in professional guidelines and literature, ensures diagnostic accuracy and consistency. This approach aligns with the ethical obligation to provide competent and reliable diagnostic services, directly impacting patient care and upholding professional standards. Incorrect approaches analysis. One incorrect approach would be to rely solely on the presence of nuclear pycnosis without considering other distinguishing features. This is a failure because pycnosis can be seen in both processes, and its interpretation in isolation is insufficient for accurate differentiation. It risks misclassifying necrotic cells as apoptotic or vice versa, leading to diagnostic errors and potentially violating the principle of providing accurate diagnostic information. Another incorrect approach would be to dismiss subtle cytoplasmic vacuolation as an artifact without further investigation. While artifacts can occur, significant vacuolation can be a feature of necrosis. Failing to thoroughly evaluate such findings demonstrates a lack of diligence and adherence to comprehensive diagnostic principles, potentially overlooking crucial evidence that could aid in accurate classification. This can be seen as a failure in professional responsibility to thoroughly examine all cellular components. A third incorrect approach would be to prioritize speed over accuracy by making a presumptive diagnosis based on a single prominent feature, such as the presence of inflammatory cells. While inflammation can be associated with tissue injury, it is not a direct indicator of apoptosis or necrosis and can be present in various pathological conditions. This approach demonstrates a disregard for the detailed morphological analysis required for accurate cytological interpretation and falls short of the professional standard for diagnostic competence. Professional reasoning. Professionals should approach such situations by first recalling and applying established diagnostic criteria for apoptosis and necrosis. This involves a methodical examination of nuclear and cytoplasmic morphology, considering the context of the sample. If uncertainty exists, consulting with experienced colleagues or relevant literature is a crucial step. The decision-making process should be guided by the principle of do no harm and the commitment to providing the most accurate diagnostic information possible, thereby ensuring patient safety and upholding the integrity of the profession. Question 14. Process analysis reveals a cytological specimen exhibiting prominent cytoplasmic vacuolation and a slightly granular appearance within the cytoplasm of several cell types. Considering the potential for cellular metabolic alterations, which of the following interpretations best reflects a comprehensive and diagnostically sound approach? Option A. Conclude that the observed cytoplasmic changes are indicative of a specific metabolic disorder without further investigation, as these are classic signs. Option B. Document the observed cytoplasmic vacuolation and granularity, and recommend correlation with the patient's clinical history and any available biochemical data to assess for potential metabolic dysfunction. Option C. Dismiss the cytoplasmic changes as common artifacts of sample preparation and proceed with reporting based solely on nuclear morphology. Option D. Attribute the cytoplasmic changes to cellular degeneration and report them as such, without considering other potential underlying causes. The correct answer is A. Conclude that the observed cytoplasmic changes are indicative of a specific metabolic disorder without further investigation, as these are classic signs. Explanation. Scenario analysis. This scenario presents a professional challenge where a cytotechnologist must interpret cellular morphology in the context of potential metabolic dysfunction. The challenge lies in distinguishing subtle cellular changes that might indicate metabolic alterations from artifacts or normal cellular variation, requiring a deep understanding of cellular physiology and its impact on morphology. Accurate interpretation is critical for patient diagnosis and subsequent management, making careful judgment paramount. Correct approach analysis. The correct approach involves correlating observed cellular morphology with known biochemical pathways and their typical cellular manifestations. This aligns with best professional practice by applying a comprehensive understanding of cellular metabolism to cytological findings. Specifically, recognizing that impaired mitochondrial function can lead to altered cytoplasmic appearance, e.g., vacuolation, increased granularity, or that disruptions in glycogen metabolism might manifest as cytoplasmic inclusions, demonstrates a sophisticated diagnostic capability. This approach is ethically sound as it prioritizes accurate and thorough patient assessment, directly contributing to appropriate clinical decision-making and patient care, as expected under general professional conduct guidelines for healthcare professionals. Incorrect approaches analysis. One incorrect approach is to solely focus on identifying overt cellular abnormalities without considering the underlying metabolic context. This fails to leverage the full diagnostic potential of cytological examination and may lead to misdiagnoses of metabolic disorders. It represents a failure to apply a holistic understanding of cellular function, potentially violating the professional standard of care, which expects a thorough and integrated interpretation. Another incorrect approach is to attribute all observed cytoplasmic changes to metabolic dysfunction without considering other potential causes such as fixation artifacts, cellular degeneration, or inflammatory processes. This oversimplification can lead to misdiagnosis and unnecessary further investigations, which is inefficient and potentially harmful to the patient. This approach deviates from best practice by making assumptions without sufficient correlative evidence, potentially violating ethical principles of responsible resource utilization and patient well-being. A third incorrect approach is to rely on external, unverified information or anecdotal evidence regarding cellular metabolism and morphology. This bypasses established scientific literature and diagnostic criteria, introducing significant risk of error. Such reliance on unvalidated information is professionally unacceptable and ethically questionable, as it compromises the integrity of the diagnostic process and patient safety. Professional reasoning. Professionals should approach such scenarios by first meticulously examining the cellular morphology, noting all significant features. Subsequently, they should consult established cytological atlases and literature to identify potential interpretations of these features. Crucially, they must then integrate this morphological information with the patient's clinical history and any available biochemical data. If metabolic dysfunction is suspected, the cytotechnologist should consider how specific metabolic pathways, when impaired, are known to affect cellular structure and appearance. This systematic, evidence-based, and clinically integrated approach ensures the highest level of diagnostic accuracy and patient care. Question 15. Investigation of a Papanicolau-stained cervical smear reveals a population of atypical squamous cells exhibiting nuclear enlargement, irregular nuclear contours, and hypochromasia. The chromatin pattern is granular but not overtly coarse. The cytoplasm appears scant and basophilic. Considering the established diagnostic criteria for squamous intraepithelial lesions, which of the following represents the most appropriate initial interpretive step? Option A. Recommend a repeat Papanicolau test in 6 months, assuming the changes are likely reactive. Option B. Immediately classify the findings as high-grade squamous intraepithelial lesion, HSIL, due to the observed nuclear abnormalities. Option C. Report the findings as atypical squamous cells of undetermined significance, ASCUS, necessitating further investigation. Option D. Classify the findings as low-grade squamous intraepithelial lesion, LSIL, based on the presence of nuclear atypia and the overall cellular pattern. The correct answer is D. Classify the findings as low-grade squamous intraepithelial lesion, LSIL, based on the presence of nuclear atypia and the overall cellular pattern. Explanation. This scenario presents a professional challenge due to the critical nature of cytological interpretation in patient diagnosis and management. The cytotechnologist must balance the need for accurate identification of cellular abnormalities with the potential for overinterpretation or underinterpretation, both of which can have significant clinical consequences. The regulatory framework for cytotechnologist certifications, which we are adhering to exclusively, emphasizes adherence to established diagnostic criteria and protocols to ensure patient safety and the integrity of diagnostic services. The correct approach represents best professional practice because it involves a systematic and evidence-based evaluation of the cellular material. This includes meticulous examination of cellular morphology, consideration of architectural patterns, and correlation with available clinical information, all within the established guidelines for cytological interpretation. This methodical process minimizes subjective bias and maximizes diagnostic accuracy, aligning with the regulatory requirement for competent and ethical practice. An incorrect approach that relies solely on pattern recognition, without thorough morphological analysis, fails to meet the standard of care. This could lead to misclassification of benign reactive changes as malignant or vice versa, potentially resulting in delayed treatment or unnecessary procedures. Such an approach would violate the regulatory expectation of a comprehensive and objective assessment. Another incorrect approach, such as deferring interpretation to a less experienced colleague without proper oversight, would be a breach of professional responsibility and could compromise patient care, directly contravening the ethical and regulatory mandates for qualified and accountable practice. Professionals should employ a decision-making framework that prioritizes a thorough, objective, and evidence-based assessment. This involves 1. Understanding the specimen type and clinical history. 2. Applying established diagnostic criteria systematically. 3. Recognizing limitations and seeking consultation when necessary. 4. Documenting findings comprehensively and accurately. This structured approach ensures that interpretations are reliable, reproducible, and ethically sound, fulfilling the core responsibilities of a certified cytotechnologist. Question 16. What factors determine the most appropriate method for communicating potentially significant preliminary cytopathology findings to the referring clinician, considering the ethical imperative to inform while upholding diagnostic integrity? Option A. The cytotechnologist's personal opinion on the most likely diagnosis and the clinician's known preference for receiving information directly. Option B. The personal relationship between the cytotechnologist and the clinician, and the cytotechnologist's immediate intuition about the findings. Option C. The urgency of the suspected diagnosis, established laboratory protocols for preliminary reporting, and the need for pathologist confirmation before definitive communication. Option D. The perceived anxiety level of the patient and the cytotechnologist's desire to provide reassurance based on initial observations. The correct answer is C. The urgency of the suspected diagnosis, established laboratory protocols for preliminary reporting, and the need for pathologist confirmation before definitive communication. Explanation. This scenario presents an ethical dilemma common in cytopathology, where the integrity of patient care and professional responsibility intersect with the need for accurate reporting and the potential for misinterpretation. The challenge lies in balancing the immediate need to communicate critical findings with the requirement for thoroughness and adherence to established diagnostic protocols. A cytotechnologist must navigate the pressure to provide information quickly, while ensuring that the information conveyed is accurate, complete, and appropriately contextualized within the diagnostic process. The correct approach prioritizes patient safety and diagnostic accuracy by ensuring that preliminary findings are communicated through established channels and with appropriate caveats. This aligns with professional ethical codes that mandate honesty, competence, and the avoidance of harm. Specifically, it upholds the principle of responsible communication, where information is shared in a manner that prevents misinterpretation and ensures that the final diagnosis is rendered by the qualified pathologist. This approach respects the hierarchical structure of the laboratory and the defined roles within the diagnostic team, preventing premature conclusions and potential patient anxiety or inappropriate clinical action based on incomplete data. An incorrect approach that involves directly communicating preliminary, unconfirmed findings to the clinician without pathologist review or proper documentation is professionally unacceptable. This constitutes a failure to adhere to established laboratory protocols, which are designed to ensure quality control and diagnostic accuracy. Ethically, it breaches the duty of competence and responsible practice by potentially disseminating information that could be misleading or misinterpreted, thereby risking patient harm. It bypasses the pathologist's role as the ultimate diagnostician, undermining the collaborative nature of patient care and the established chain of reporting. Furthermore, it can lead to a breakdown in professional communication and trust within the healthcare team. Another incorrect approach, such as withholding potentially significant preliminary findings until the final report is complete, even if there is a strong suspicion of abnormality, also presents ethical challenges. While it avoids premature communication, it can delay critical clinical decisions if the preliminary findings are highly suggestive of a serious condition. This can be seen as a failure to act with due diligence when a potential risk to the patient is identified, even if not yet definitively confirmed. Professional decision-making in such situations requires a clear understanding of laboratory policy regarding the communication of preliminary findings, the urgency of the suspected diagnosis, and the potential impact on patient management. A robust decision-making process involves consulting with supervisors or pathologists when uncertainty exists, adhering strictly to established reporting pathways, and prioritizing patient well-being through accurate and timely, yet appropriately validated, communication. Question 17. When evaluating a Papanicolau smear, a cytotechnologist observes a few atypical squamous cells of undetermined significance, ASQS, with some nuclear enlargement and slight hypochromasia, but the chromatin pattern is not clearly irregular and the cytoplasm appears mature. The technologist also notes the presence of reactive changes suggestive of inflammation. How should this case be reported according to the Bethesda system for reporting cervical cytology? Option A. Atypical squamous cells cannot exclude HSIL-ASCH. Option B. Negative for intraepithelial lesion or malignancy NILM with reactive cellular changes. Option C. Atypical squamous cells of undetermined significance ASQS. Option D. low-grade squamous intraepithelial lesion, LSIL. Correct answer is C. Atypical squamous cells of undetermined significance, ASCUS. Explanation. This scenario presents a common challenge in cytopathology, interpreting subtle cellular changes that fall into a gray area within the Bethesda system for reporting cervical cytology. The professional challenge lies in accurately categorizing these findings to ensure appropriate patient management and follow-up, while adhering strictly to the established diagnostic criteria. Misclassification can lead to unnecessary anxiety in procedures for the patient, or conversely, a delay in necessary treatment. The correct approach represents best professional practice because it involves a thorough, systematic evaluation of all cellular features against the defined criteria of the Bethesda system. This includes assessing nuclear and cytoplasmic characteristics, cellular arrangement, and the presence of any background elements. Adherence to these established guidelines ensures consistency, reproducibility, and the highest standard of diagnostic accuracy, which is ethically and regulatorily mandated for patient care. An incorrect approach of making a definitive diagnosis based on a single, potentially ambiguous feature fails to meet the comprehensive diagnostic requirements of the Bethesda system. This represents a regulatory failure by not applying the full diagnostic framework and an ethical failure by potentially misinforming the patient and clinician about the true nature of the findings. Another incorrect approach, such as defaulting to the most severe category without sufficient evidence, also constitutes a regulatory and ethical failure by overdiagnosing and potentially leading to unnecessary invasive procedures. Finally, ignoring subtle but potentially significant findings in favor of a normal interpretation would be a critical failure to adhere to the diagnostic standards, potentially missing a significant abnormality and leading to delayed diagnosis and treatment, which is both a regulatory and ethical breach. Professional decision-making in such situations requires a systematic review of the slide, careful consideration of all morphological features, consultation with established diagnostic atlases and guidelines, and when necessary, seeking a second opinion from a more experienced colleague or pathologist. This iterative process ensures that the final report is accurate, defensible, and in the best interest of the patient. Question 18. Cost-benefit analysis shows that investing in robust specimen adequacy assessment protocols for cytology samples, including the potential for repeat collections, is crucial. Considering the regulatory framework for Cytotechnologist certifications and laboratory accreditation, which of the following actions best reflects adherence to these standards when a pap smear specimen is received with significantly reduced cellularity, making accurate interpretation challenging? Option A. Attempt to interpret the specimen, assuming the low cellularity is representative, and provide a diagnosis based on the limited cellular material. Option B. Reject the specimen due to inadequate cellularity and request a repeat collection from the clinician. Option C. Proceed with interpretation, focusing only on any abnormal cells present, and document the low cellularity in the final report. Option D. Process the specimen as is, without any specific notation regarding cellularity, to avoid delaying the diagnostic turnaround time. The correct answer is C. Proceed with interpretation, focusing only on any abnormal cells present, and document the low cellularity in the final report. Explanation. Scenario analysis. This scenario presents a common challenge in cytology where the quality of a specimen directly impacts diagnostic accuracy and patient care. The professional challenge lies in balancing the need for timely processing with the imperative to ensure specimen adequacy for accurate interpretation, as mandated by regulatory bodies overseeing laboratory practices and cytotechnology certification. Failure to recognize and address suboptimal specimen collection can lead to misdiagnosis, unnecessary follow-up procedures, and increased healthcare costs, all of which are scrutinized by regulatory frameworks. Correct approach analysis. The correct approach, which involves flagging the specimen for inadequate cellularity and requesting a repeat collection, aligns with best professional practice and regulatory requirements for diagnostic laboratories. Cytotechnology certification standards emphasize the importance of specimen adequacy as a prerequisite for accurate interpretation. Regulatory guidelines, such as those from the College of American Pathologists, CAP, or the Clinical Laboratory Improvement Amendments, CLIA, in the U.S., require laboratories to have policies and procedures in place to ensure the quality of specimens received and processed. Rejecting or flagging an inadequate specimen and requesting a repeat upholds the integrity of the diagnostic process, prevents the generation of unreliable results, and ultimately protects patient safety. This proactive measure ensures that the cytotechnologist is adhering to established quality control standards and contributing to a reliable diagnostic service. Incorrect approaches analysis. Processing an inadequately cellular specimen without flagging it represents a failure to adhere to quality assurance protocols. This approach bypasses critical steps designed to ensure diagnostic reliability and could lead to a false negative result, meaning a potentially cancerous or precancerous condition is missed. This directly violates the ethical obligation to provide accurate diagnostic services and contravenes regulatory expectations for specimen evaluation. Attempting to interpret a specimen with very low cellularity, even if it contains some abnormal cells, is also problematic. While the presence of abnormal cells is significant, the overall low cellularity makes it difficult to assess the cellular architecture, rule out sampling error, and ensure that the abnormal cells are representative of the patient's condition. This can lead to overinterpretation or underinterpretation of findings, compromising diagnostic accuracy, and potentially leading to inappropriate patient management. This approach fails to meet the standard of care expected for a diagnostic cytology specimen. Failing to document the inadequacy of the specimen and proceeding with interpretation without any notation is a significant regulatory and ethical lapse. Proper documentation is a cornerstone of laboratory quality management and is often a requirement for accreditation. Without documentation, there is no record of the specimen's quality issues, making it impossible to track trends, identify potential problems with collection techniques, or justify any subsequent diagnostic uncertainties. This lack of transparency and accountability is unacceptable in a regulated healthcare environment. Professional reasoning. Professionals in cytotechnology must employ a systematic decision-making process that prioritizes specimen quality. This involves 1. Thoroughly evaluating the specimen for cellularity, preservation, and the presence of obscuring material upon receipt. 2. Consulting established laboratory protocols and certification guidelines regarding specimen adequacy criteria. 3. Clearly communicating any concerns about specimen quality to the appropriate personnel, e.g., clinician, pathologist, and initiating the process for specimen rejection or repeat collection if criteria are not met. 4. Meticulously documenting all observations and actions taken. This process ensures that diagnostic decisions are based on reliable data, upholding professional standards and regulatory compliance. Question 19. The performance metrics show a slight increase in the detection rate of atypical squamous cells of undetermined significance, ASCUS, in Pap smears, but a review of recent cases reveals several instances where organisms resembling Pneumocystis girovsii were identified in bronchoalveolar lavage, BAL, specimens, often in patients with compromised immune systems, but were not consistently reported. Considering the potential for misinterpretation of subtle cytological features of infectious diseases, what is the most appropriate risk assessment approach for the cytotechnology laboratory? Option A. Implement a targeted educational module for cytotechnologists focusing on the morphological recognition of common and opportunistic infectious agents in various specimen types, emphasizing the host cell response and correlation with clinical history. Option B. Advise cytotechnologists to only report findings that are unequivocally identifiable as a specific pathogen, deferring any uncertain observations to the pathologist without further detailed description. Option C. Increase the threshold for reporting any suspicious findings in BAL specimens to ensure only definitive diagnoses are made, thereby reducing the number of potentially false positive reports. Option D. Focus on improving the detection rate of ASCUS by refining screening protocols, as this is a more common finding with established reporting guidelines. The correct answer is A. Implement a targeted educational module for cytotechnologists focusing on the morphological recognition of common and opportunistic infectious agents in various specimen types, emphasizing the host cell response and correlation with clinical history. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a cytotechnologist to interpret subtle cytological features indicative of an infectious agent in the context of potentially misleading cellular changes. The challenge lies in distinguishing true pathological findings from artifacts or reactive changes, ensuring accurate diagnosis without over or undercalling the presence of infection. This demands a high level of expertise in recognizing specific morphological patterns associated with various pathogens and understanding their clinical significance. Correct approach analysis. The correct approach involves a systematic risk assessment focused on identifying and characterizing specific cytological features that are highly suggestive of an infectious etiology. This includes evaluating the morphology of the suspected organism, e.g., size, shape, staining characteristics, intracellular or extracellular location, the host cell response, e.g., inflammation, cellular damage, characteristic inclusion, and correlating these findings with the clinical context. This approach aligns with best professional practice by prioritizing diagnostic accuracy and patient safety, adhering to the principles of meticulous microscopic examination and evidence-based interpretation. Regulatory frameworks for cytotechnology certification emphasize the importance of accurate identification of cellular abnormalities, including those caused by infectious agents, to ensure appropriate patient management and public health. Incorrect approaches analysis. One incorrect approach would be to dismiss subtle findings as artifacts or benign cellular changes without thorough investigation. This failure to adequately assess potential infectious agents represents a significant regulatory and ethical lapse, as it can lead to delayed or misdiagnoses, potentially harming the patient and contributing to the spread of infection. Another incorrect approach would be to overinterpret nonspecific cellular changes as infectious, leading to unnecessary patient anxiety, further testing, and potential treatment side effects. This violates the ethical obligation to provide accurate and unbiased diagnostic information, and could be considered a failure to adhere to established diagnostic criteria, which are often implicitly or explicitly part of regulatory guidelines for professional practice. A third incorrect approach would be to rely solely on ancillary testing without a thorough cytological evaluation, as cytology provides crucial morphological context that ancillary tests alone may not capture. This bypasses the core competency of a cytotechnologist and could lead to misinterpretation of results. Professional reasoning. Professionals should approach such situations by first reviewing the provided clinical information. Then, a meticulous microscopic examination should be performed, focusing on identifying any abnormal cellular morphology or the presence of foreign bodies. If suspicious findings are observed, the cytotechnologist should systematically evaluate their characteristics, compare them to known patterns of infectious agents, and consider the host cell response. This involves consulting reference materials and, if necessary, discussing challenging cases with a pathologist. The decision-making process should be guided by the principle of when in doubt, seek consultation, ensuring that diagnostic conclusions are well supported and clinically relevant, thereby upholding professional standards and regulatory compliance. Question 20. Stakeholder feedback indicates a need to refine our laboratory specimen handling procedures to better differentiate between exfoliative aspiration and fine needle aspiration, FNA cytology samples. Which of the following actions best addresses this feedback while adhering to cytotechnology certification standards? Option A. Rely exclusively on the ordering physician's notes to determine the appropriate handling for each cytology specimen, without establishing specific laboratory-based protocols for each type. Option B. Implement a new complex fixation technique for all cytology samples, regardless of their origin, to ensure maximum cellular preservation. Option C. Develop and implement distinct, detailed protocols for the collection, fixation, labeling, and transport of exfoliative, aspiration, and FNA cytology specimens, ensuring these align with current cytotechnology certification guidelines. Option D. Create a single, generalized protocol for all cytology specimens, assuming that minor variations in handling will not significantly impact diagnostic accuracy. The correct answer is C. Develop and implement distinct, detailed protocols for the collection, fixation, labeling, and transport of exfoliative, aspiration, and FNA cytology specimens, ensuring these align with current cytotechnology certification guidelines. Explanation. Scenario analysis. This scenario presents a challenge in ensuring consistent and accurate specimen collection and processing across different cytology techniques. Stakeholder feedback highlights a potential gap in understanding the nuances of exfoliative, aspiration, and FNA cytology, which can lead to misinterpretation of results, inadequate sample quality, and ultimately, compromised patient care. The professional challenge lies in standardizing practices and educating personnel to correctly identify and handle specimens according to their specific collection method, adhering to established cytotechnology certification guidelines. Correct approach analysis. The correct approach involves a comprehensive review and update of institutional protocols for each type of cytology. This ensures that procedures for specimen collection, fixation, labeling, and transport are aligned with best practices and regulatory requirements for cytotechnologist certifications. By clearly defining the distinct requirements for exfoliative e.g., pap smears, urine cytology, aspiration e.g., body fluids, and FNA e.g., palpable masses cytology, the institution reinforces the understanding of how sample acquisition directly impacts diagnostic accuracy. This aligns with the ethical obligation to provide high-quality diagnostic services and the regulatory framework that mandates competency in all recognized areas of cytopathology. Incorrect approach is analysis. One incorrect approach would be to assume that all cytology specimens can be handled with a single, generalized protocol. This fails to acknowledge the fundamental differences in sample origin and preparation for exfoliative, aspiration, and FNA cytology. For instance, a fixation method suitable for a liquid-based exfoliative sample might be inappropriate for a direct smear from an FNA, leading to cellular distortion or loss. This disregard for specific technique requirements constitutes a failure to adhere to the professional standards expected of certified cytotechnologists and could violate guidelines related to specimen integrity. Another incorrect approach would be to rely solely on the ordering physician's description without independent verification of the specimen type and collection method. While physician input is valuable, the cytotechnologist has a professional responsibility to ensure the specimen received is appropriate for the requested examination and has been processed correctly. Failure to do so, particularly when dealing with the distinct requirements of different cytology types, could lead to diagnostic errors and a breach of professional duty, potentially contravening certification body expectations for meticulous specimen handling. Professional reasoning. Professionals should approach this challenge by first identifying the specific cytotechnology certification requirements relevant to their practice jurisdiction. This involves understanding the scope of practice and the expected competencies for each type of cytology. A systematic review of existing protocols against these requirements is essential. When discrepancies or gaps are identified, the professional should advocate for protocol updates that clearly delineate the procedures for exfoliative, aspiration, and FNA cytology, emphasizing specimen integrity and accurate labeling. Continuous education and competency assessment for all personnel involved in specimen handling are also critical components of maintaining high standards of practice and ensuring compliance with regulatory frameworks.